This is your last appearance at the podium. You became a household name in large part because of your appearances here at the early stages of COVID. What do you want Americans to remember about your service in government?
Well, I think what I've accomplished in my 54 years at the NIH and my 38 years as the director of NIAID, although COVID is really, really very important, it is a fragment of the total 40 years that I've been doing it. So I'll let other people judge the value or not of my accomplishments. But what I would like people to remember about what I've done is that every day for all of those years, I've given it everything that I have, and I've never left anything on the field. So if they want to remember me, whether they judge rightly or wrongly what I've done, I gave it all I got for many decades. If there are oversight hearings, I absolutely will cooperate fully and testify before the Congress if asked. You may not know, but I've testified before the Congress a few hundred times, okay, over the last 40 years or so. So I have no trouble testifying. We can defend and explain and stand by everything that we've said.
What was the most difficult moment of the pandemic response for you?
So that's a really difficult question to answer, but the most difficult because, we've all lived through almost 3 years of the most horrendous outbreak that we've experienced as a society in well over 100 years. But there are certain things that stand out. I mean, I could probably write an essay on all the things that were difficult time. But one of the things as a physician whose goal in life is to care for patients and to prevent and treat illness and ameliorate suffering is that I remember back in my days in medical school and when I was an intern and a resident, when a patient came in, whether or not the patient didn't like you, was angry with you, whether it was a rich person or a poor person, you treated everybody the same because you cared about them and you wanted everyone to walk out healthy. So when I see people in this country, because of the divisiveness in our country, of not getting vaccinated for reasons that have nothing to do with public health, but have to do because of divisiveness and ideological differences, as a physician, it pains me because I don't want to see anybody get infected. I don't want to see anybody hospitalized.